Mental Health Technology Transfer Center School Mental Health webinar this morning. This is a community of practice for our course about cultivating compassionate school communities. Today's focus will be selling mental health and social emotional learning to decision makers. You're joining us here today with myself, Dana Asby. I'm the Education Coordinator of the New England MHTTC, and Dr. Martha Staley, who's the Director of the School Mental Health Initiative of the New England MHTTC. I'd like to acknowledge the traditional ancestral unceded territory of the Wappinger Nation, now known as the Greater New Haven, Connecticut area, where Martha and I are joining from today. Our funding does come from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's webinars are those of the presenters and not SAMHSA. The Mental Health Technology Transfer Center Network uses person-centered, affirming, respectful, recovery-oriented language in all activities. So during this webinar, please ensure that whenever you're contributing to our discussion via the chat or in the question and answer session of our webinar, that you use language that is strengths-based, healing, and trauma responsive. Microphones are going to be muted during the presentation portion of our time together, and during the question and answer session, you can use the raise your hand feature to request an open mic. When you are speaking, please be sure to eliminate background noise. You can also submit questions for Martha and I throughout the presentation session of today's time using the chat. We are pleased to offer the option of closed captioning for this webinar, so you can select this option and change the transcription settings by clicking the CC Live transcription button that's at the bottom of your Zoom screen. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please do send a private chat to Ingrid Paget, our technical support manager for today's webinar. So thank you again for joining us. We are here today in a community of practice about our healthy knowledge course, Cultivating Compassionate School Communities that Respond to Trauma Effectively. Ingrid's going to drop a link to that course in the chat. This is our third session of the community of practice, and from feedback from you all from the first two sessions, we know that not everyone has had a chance to take the course and that you're more interested in getting some practical tools to be able to promote compassionate school practices and to also sell this idea of social emotional learning and mental health support and perhaps the course itself to your districts or school administrators. So in today's session, we'll be focusing on that idea, just selling the idea of social emotional learning and mental health. And in some follow-up sessions for this community of practice, we've taken other ideas of what you need to really go into your schools right now to make a difference in these areas in your students' lives. And we'll talk about that towards the end of today's time together. So for today, we'll start off with a mindfulness moment to bring us all together into this space with a little bit less stress and anxiety. We'll go around the room and do some introductions of who is here and your roles and how you use social emotional learning and potentially how you'll use this course with your students or staff. Then we'll talk a little bit about how to make the case with decision makers that mental health supports and social emotional learning are really important right now. We'll then move on to explain what social emotional learning is and give some ideas of effective programs that offer support around social emotional learning. Then we'll do the same thing for mental health support and then open it up to questions and answers and talk about next steps for this community of practice. So let's start with a mindfulness moment all together. So you can go ahead and find a comfortable seat. We're going to do a little bit of chair yoga today. So if you do have a chair that you want to scoot back a little bit from your desk, you're welcome to do that. But chair yoga can also be done on your couch or on the floor, wherever you feel most comfortable. So first, let's find a bit of a straight back with our feet on the floor. And we're just going to first take a moment to release any tension that we might have in our body, starting with the top of our head, paying attention to if our eyebrows might be scrunched up a little, letting that relax down a bit, thinking about our jaw and whether we're clenching that jaw, paying attention to where our tongue is, if it's stuck to the roof of the mouth, gently letting that come down and maybe even opening the mouth up a little bit to stretch that jaw. Then giving a second to pay attention to our shoulders, making sure that they're not scrunched up by our ears, but rather relaxed down, maybe even back a little bit. And then traveling down our torso and our legs and just releasing any tension there. Might even be helpful to clench up and curl your toes and then let them out and open. So we'll just do a very brief chair yoga sequence to get us all in the present moment together. So you can just take your arms, and as you breathe in through your nose, just lift your arms up above your head, looking up to the sky, and perhaps even leaning back in your chair just a little bit. And then as you release your breath, just let your hands come back down to your knees. We'll do that 2 more times, inhaling our hands up as we look up at the sky, leaning back a little. And then exhaling as we bring our hands down. And 1 more time, inhaling the arms up above the head, leaning back slightly. Exhaling, bringing the hands down. Now we can bring our hands out in front of us, right, straight, pointing forward. And we're just going to cross the right elbow over top of the left elbow. And you can bring your hands where the palms are back to back, or you can kind of wrap the hands around, and then just bend the elbows, bringing the hands closer to the face, bringing the elbows down. This stretches out the back of our neck, or our shoulder blades rather, just a little. Then you can release and shake it off. Then just do the same thing, bringing the left elbow over the right. The backs of the hands can touch. You can link up your thumbs or come palm to palm, whatever feels comfortable to you. Bending the elbows and bringing the hands closer to the face, stretching out those shoulder blades. And releasing and shaking off. Then for the last pose, you can either just put your hands right in front of you if you don't have a desk or anything in front of you, and start slowly bending forward. Or if you have a desk in front of you, you can place your hands on the desk and just start to bring your head down closer and closer towards the desk, reaching your hands farther out in front of you, leaning down towards the lower half of your body, stretching out those shoulders, and slowly come back up. So just taking a few moments of doing some chair yoga like that can really help us make sure that our bodies are getting the movement that we need. I know I've been hearing a lot of New Year's resolutions are to move our bodies more because we are spending more and more time here in front of the computer. So hopefully you got a chance to just stretch things out and move things around, and you can take that back with you to your colleagues and even your students if you're working with youth in the schools. And I'll pass it over to my colleague, Martha.
Thank you so much, Dana. I love starting out with those. We have found as a team at MHTTC that we also do that as an instructional tool, but also for ourselves as we are sitting in front of computers constantly. So my name is Martha Staley. I am the site lead for the School Mental Health Initiative of the MHTTC, and I am on the faculty of Yale School of Medicine in the Department of Psychiatry. I started my career as a high school and middle school English teacher, and now work in public psychiatry. So I am going to pass it to Dana, and then I would love it if you feel comfortable introducing yourself. Let us know your name, where you are from, your role in youth mental health or service or schools, and how you plan or are using SEL programs in your school, just briefly. So I will pass it to Dana.
Hi, thank you, Martha. So my name's Dana Asby, and I'm the education coordinator at the New England MHTTC, and I'm here in New Haven, Connecticut. And like Martha, my role is to help educate the school-based mental health support system providers, and any educators and administrators who work in schools to better support young people's mental well-being. So if Adam feels comfortable sharing, Adam, you can unmute yourself.
If you'd feel more comfortable doing it in the chat, please feel free to do that if you'd rather not speak.
We can also go to Ariel. Ariel, if you want to introduce yourself.
Sure. I'm Ariel, and I'm based in Keene, New Hampshire, and I am the Regional Substance Misuse Prevention Network Coordinator for the Greater Monadnock region. And so much work is being done currently when it comes to SEL and trauma-based education that if there's any information that I can glean that will help our educators back here sort of enhance what they're doing and roll these things out to other schools. That's how I see myself sort of fitting into all of this.
Great. Can you pick another person from the participants to introduce themselves?
Sure. I guess Adam can go if he is on there now.
Yep, I'm back. Yep, my name's Adam Sodawasser. I work for a nonprofit called Substance Abuse Services, and I have 7 schools that I work with as a prevention coordinator. And I just provide substance abuse prevention K through 12th grade at most of these schools. Sometimes I'm there weekly, other times it's there for a few presentations throughout the year. And I plan on using this within small groups as well as sharing a lot of the information with staff at each school.
Wonderful. Thank you so much, Adam. Let's see. T. Roof. Roof?
No, sorry, that's the way our school breaks it down. My name is Trina Roof. I am a middle school counselor in Northern Virginia in Fauquier County. Actually, I work primarily with grades 6 through 8. I am the full-time counselor, and I have about 460 students between the 3 grade levels. I have a part-time counselor that works with me 2 days a week. I know with everything that we had gone through the past 18 months, trying to get students used to interacting with each other and just checking in with themselves is the hardest part. They don't know how to interact with each other. So I'm hoping to learn some things to take into some of our classrooms and use from here on out.
Thank you so much, Trina. Trina, right?
Yes, Trina.
How about Amara?
Hello, my name is Amara. I'm from Pakistan, and I'm the founder and director of Pearls and Pebbles. So basically, I make and design value-based activity for children, ranging from preschoolers all the way to teenagers. And right now, I provide private personalized content for parents, for example, compassion or charity, to inculcate certain types of values, specific values for their children. And I'll be releasing my content publicly for schools and for people. And I hope to gain a lot from this. Thank you.
Thank you so much, Amara, and for probably being our person from the farthest distance. How about Mary Kate?
Hi, I'm Mary Kate Stimson. I'm a school psychologist at 2 elementary schools in Rhode Island, in Chariho Public School District. So I service about 450 kids that are under my wing. I do special education testing as well as mental health services. And I plan to use this course in small groups and individuals and sharing it with staff as well. We're doing a lot of we're getting a really different population that's coming our way. So just working with staff to support them and help them support their students.
Thank you so much, Mary Kate. Amneris, I don't know if I'm pronouncing that correctly. Okay, Meredith? Oh, sorry, you introduced yourself in the chat. Sorry about that. And 3 BCS mom. That's okay. If you want to introduce yourself and just let us know where your what your role is, or if you have any questions, it's helpful to know who's in the room with us today. This is a community of practice, so we want to. Our topic today is about advocating for SEL training, support, and curricula within your school district into leadership, which came from our previous sessions in this community of practice about great, but I can't convince the leaders, the district leaders or the school board that this is important when everyone is so concerned about safety and academics, right? You know, the resources are thin, everybody is overloaded, and many of the people who join us for these sessions have shared with us that they are having a hard time knowing how to advocate for people. For SEL programming in their schools. I got distracted because Dana just reminded me that I didn't offer Matthew an opportunity to introduce himself. I'm sorry about that.
No worries. I was actually just typing in the chat anyway. But I'm actually another Rhode Islander. So talk about a small world. We always find each other some way or another. I'm the student supports team lead at Times Square Academy in Providence, Rhode Island. I started this position in October. Prior to that, I worked in community mental health as a school consultant around mental health and trauma-informed care in particular. Starting at Times 2, I definitely see it's a challenge to get staff on board with understanding that trauma-informed care isn't just a get out of jail free card for kids. It's important that there is still that accountability, and but doing it in a way that isn't going to be re-traumatizing or compounding stress for kids that is already pretty significant right now. So kind of building some of that insight and understanding moving forward.
Thank you so much, Matthew. Did anybody else want to go before I go on?
I just wanted to say one thing, knowing now who's in the room and how familiar you all are with social emotional learning and mental health, to just acknowledge that this is also a way for you to get some slides that you could replicate what we're going to present here so that you can sell this to your districts as well. So during some of the presentation when you might be thinking, this is stuff that we already know, that's kind of the reasoning behind what we're doing here too.
Yes, thank you, Dana. That's really important. We are not presenting this as if now you need to understand what a social emotional program is, but so that you could take this information and explain it to somebody to whom you are advocating for this type of programming. So we'll go through that part very quickly since we're familiar with that, and just orient you to these slides, which you will get a copy of and can use with attribution to MHTTC, but use and distribute freely. Let's go to the next slide. Thank you. So we will spend some time just telling you a little bit about this, and then we will move through the rest of the slides. As we all know, COVID has really affected kids and teens' mental health, including their levels of trauma and including compounding and magnifying trauma. So I think this is a group that's pretty familiar with how the incidence, the severity, the prevalence of these types of conditions has just grown exponentially. And we don't even know yet how high these numbers will go, unfortunately. So thank you to all of you who are committed to trying to intervene early and often as those numbers go up. Next slide. You know, over half of students, this is about high school students, are worried, anxious, depressed, either thinking about suicide or self-harm themselves, or know somebody who is experiencing those types of feelings, thoughts, and behaviors. So, and again, please feel free to use these statistics as part of the case that you want to make, which is, this isn't just touchy-feely stuff about, wouldn't it be nice if we all had the time to tend to students' mental health. This is part of the case that we're making, which is that youth mental health in this country is, youth are in a crisis. We're all in a crisis, but they are bearing a lot of burden for what has happened, particularly over the last couple of years. Next slide. So this is just a very basic, if you're explaining to a neighbor, a family member, a school board member, what are social emotional skills, feelings, awareness, decision-making, and relationships. Next slide. Social emotional programs focus mainly on 4 areas. Skills, so a specific program to teach youth about social emotional skills. Habits, so activities to teach youth good habits and prevent problems. Supports, identifying who can help when, how to connect kids or youth who are struggling to those people, and a focus on community. So when you're advocating for social emotional programming, these are the 4 things that you are saying are really important. Next slide. And we know that it's not sufficient to just have schools or teachers working on this. It's more impactful. These sorts of skills and programs are more impactful when schools and families and communities are working together and reinforcing these skills and values, and that schools are in a great position to be the bridge between community health providers and schools, and families, but can also be responsible for helping to disseminate this information to providers and make those connections. And then offer a model and support and coaching to parents and families and communities that are wanting to reinforce these skills at home. So again, these are skills, they can be learned. We all have to learn them. So we want to make sure that everybody has access to the skills and information to do that. And that consistency is really key. So the more communication schools are doing in the community and with families and vice versa, the better. And the stronger these skills are going to be in the kids. Next slide. So I'm going to pass it to Dana now to give a couple of examples and tell more about our vision of social emotional programming.
So we know that we hear from so many school mental health providers that even now during COVID, when all of us are going through collective trauma, schools are still really focused on the academic side of things, trying to catch up with that learning gap. But we really understand the neurobiology of trauma and how impossible it is for students to learn when they're actively dealing with a trauma or trying to heal from a trauma. Their brains really are not primed for learning. And CASTLE is an organization that really understands that as well, and understanding and sharing this wheel that they have come up with about how to really infuse these social emotional learning skills alongside academic skills can be really powerful. And they've come up with a comprehensive guide to evidence-based social emotional programs, where they have really surveyed an enormous amount of educators about what is actually working on the ground for them, and looked at research studies that have an evidence base to recommend specific programs. And some of the most popular ones that we hear about, especially in the New England region where we are is the ruler approach, which is from Yale University, conscious discipline, mind up, and second step. Those are all really popular ones up here that have been shown to have a lot of success. And then some of the other ones that we've heard that are newer, but also promising are also in the secondary grades as well, facing history and ourselves, student success skills, and then leader in me. All of these are linked here for you to check out, but I would also encourage you to look at the CASEL website to peruse their guide, which really gives you more information about the specific skills that are needed, because we do know that every school community is unique, and we like to provide a menu of options for you to get exactly what you need. But it can feel overwhelming when you're trying to choose a program. So going to a really well-respected organization like this to get lots of people's opinions and see what's worked for them can be really helpful when trying to choose a social emotional curriculum. It's also important to get feedback from the staff who are going to be teaching this in the classroom, as well as families and even students who might be using the curriculum themselves. So now I'd like to talk about how we can explain mental health support practices to our decision makers in our school communities. We at the Childhood Trauma Learning Collaborative in the New England MHTTC, we've developed this model, the Compassionate School Mental Health Model, which we really feel is a way to help youth develop well-being that's very holistic wherever they are, whether that's in their homes, in the community, in the schools where they are, and in the youth serving systems that they find themselves in. That might be the justice system, the foster care system, the medical system, any various systems. So we have a 4-quadrant approach where we think all of these things need to happen in all of these environments at the same time. We need to be doing things to work towards prevention of trauma and mental health crises. We need to support youth who are currently experiencing trauma and mental health crises. We need to build resiliency so that they can bounce back more quickly, and develop protective factors so that they are not affected by trauma and mental health challenges as deeply. So we're just quickly going to go through a few ways that you as an individual in a school or as someone who's asking an administrator can really make a difference in all of these areas. So to prevent mental health challenges and trauma from happening, a really important aspect is to educate all staff, from the folks who pick the children up on the bus in the morning, to the cafeteria workers, to the secretaries in the front office, to the educators and paraprofessionals that are there in the classrooms with the children, alongside the administrators who are making decisions. Everyone needs to have a base level understanding about trauma, mental health, and wellness. So the course that we have created, Cultivating Compassionate Communities that Respond to Trauma Effectively, it does a really great job of educating staff about that in a really understandable, easy to access way. It's also important for us to provide lots of different strategies for self and community care. We did a bit of mindfulness at the beginning. Lots of schools have found success with creating a mindfulness program. For staff and for students, we can create some kind of club or class around fitness, walking, do some wellness fairs to just introduce these wellness ideas to families and the broader community, and also have a chance to practice wellness activities together in the moment, which also creates a sense of belonging and community. Another really important aspect of preventing trauma and mental health challenges is to think about our holistic health, not just our mental health, but our physical health as well, because we know that has a very large impact on our mental health. So making sure that our families have connections to local pediatricians and mental health care providers, offering free dental and eye screenings at our schools whenever possible, making sure that families are aware of the McKinney-Vento liaison that supports any family experiencing houselessness, giving information about how to apply to SNAP programs and other federal programs that give assistance, making sure that we have a strong connection to local organizations in our community that offer other types of support, such as domestic violence, any clothing or food support that might be necessary, and having literature in multiple languages so that all families can access these support systems. This is all a part of mental health support. When we're talking about supporting the youth that are currently experiencing mental health challenges, we want to see if it's right for our school to use trauma-informed universal screening tools. And we have an asterisk there because if you don't have the staff available to actually provide one-on-one or group support when any kind of mental health issue is identified, it might not be the right choice for your school or district. And we do have a lot of literature about trauma-informed screening practices available. So reach out to us if you would like to learn more about that. It's also important to connect with local organizations and agencies that do provide some of these services and invite them into the school building, because we know that it's a barrier to access when we ask parents, especially parents who don't have transportation, to go outside the school building to get these services. So bringing them in as much as possible is really helpful. And if you'd like to learn more about those types of collaborations, we have another community of practice about healthcare workers and educators addressing and reducing trauma that we'll talk more about at the end of today's presentation. It's also important to just have a list, a paper list, an online list of the various mental health agencies and healthcare centers that do have services for children and families. And again, having those in multiple languages is really important. One really key thing that we talk about is the need for universal. That means the whole school, every student in the school building or in the district receives social emotional learning, suicide prevention, and mental health literacy programs. And we'll give some ideas of some places to go for those in just a moment. Another way to support youth that are experiencing mental health challenges is to create leadership opportunities for students, staff, and families, because when everyone is feeling more empowered, that's going to allow us to come together and work towards transformational change to create more equitable and trauma-informed environments as well. We also want to make sure that we're building resiliency for our students to be able to bounce back when trauma does occur. So with that universal social emotional programming, there might be a need to give some targeted social emotional skill building for certain students who are really struggling and need a little bit extra practice. That might come on one-on-one. It might also be a part of small groups that are targeting specific mental health issues like anxiety and depression. We also want to make sure that however we're engaging with young people, we're providing a lot of opportunities for student choice, because we know when trauma occurs, there's a lack of agency there that needs to be nurtured and rebuilt. So including choice in allowing students to choose their classes, of how they complete their assignment, what extracurriculars that they are involved in, and other areas. And then also making sure that we always have ways to listen to our students and families' voices, and creating multiple pathways for students and families to share their opinions with us. Finally, for our fourth factor, to develop protective factors to buffer against trauma and mental health challenges, it is important to train students, staff, and families on how to be nurturing, how to create these relationships that really help us heal from trauma, and also, buffer against trauma. So this can include teaching positive communication skills, active and reflective listening, doing some work on developing growth mindsets, moving away from this idea that we're born with a certain level of ability and we can never change it, onto the fact that our brains are plastic and we can really do things that change the structure of our brain so that our intelligence and skill level is always able to grow with practice and the right kind of support. Using mindfulness practices to be more present and connected to each other and use more compassion when we're in relationships. Also teaching some conflict resolution skills and using restorative justice rather than punitive discipline measures that exclude, like suspension. So we have lots of resources, and all of these things are touched on in our course as well. So make sure to check out our website at the New England MHTTC School Mental Health Initiative to get links to some more professional development opportunities and resources to share with your school on all of those things. It's also important to work towards becoming a trauma skilled school. And using the course that we created really gives you a blueprint for exactly how to get closer to that, no matter where you are on that journey. Included in our course is an action plan that can really help you understand all the various steps to get towards that place where you really are working together to develop a nurturing adults in a trauma responsive environment. Another aspect of these protective factors is making sure that all of our school activities and our school environment is as equitable as possible. So doing some training on cultural humility, which is really not a one-time thing, but a lifelong journey. So checking in regularly around our ideas about cultural responsiveness and cultural humility. Maybe even considering a compassionate conversation, which is a really great model by Singleton and Linton. They have come up with a way to really focus our emotional and intellectual ideas around equity so that we can have conversations with each other about really difficult topics that don't necessarily resolve everyone's various opinions and ideas around equity, but really get us started on working together to try to create this more equitable environment. Finally, making sure that we promote belonging, having lots of different events in various arenas that bring everyone together and make us feel like a team, that we're working together to try to achieve this as a unit. So that's how we approach mental health supports, as like a menu of options. And we have, I want to just also acknowledge that there are some really great evidence-based mental health support systems out there. Many of you on this call are probably familiar with the MTSS model that looks at the tier 1, the universal, everyone in the school, the tier 2, those who have been identified as needing some extra supports, and then the tier 3, those students who are really in an acute crisis that need some really targeted, really important, perhaps even support that comes from outside the school building. And this is the integrated multi-tiered systems of support that looks not just at what's happening in the school building, but brings in different community organizations and making sure that the family as well is really involved in all of these mental health supports, from universal all the way up to that tier 3. And there's a link on this slideshow where you can learn more about that. And the broader MHTTC network has done some really great webinars on this topic as well. Another few resources that come out of our national network include the National School Mental Health Best Practices. This is a training that has many different modules on really how to set up a comprehensive school mental health system within your school, district, or state. And we partnered with the National Center for School Mental Health to create this. And alongside this trainer manual, there's also a series of videos where various schools and districts who have implemented the best practices come on and explain some of their challenges and successes around doing that. So you can use this trainer's manual and the accompanying slideshows as picking out the issues that your school or district needs the most, or you can go through it start to finish and get a lot of information about how to create that comprehensive school mental health system yourself. And then the SHAPE system, the School Health Assessment and Performance Evaluation System, is a tool that you can use alongside that to help evaluate how well your district, school, or state is how well you have already set up your comprehensive school mental health system, and identify any kind of improvements. Another really great aspect of the SHAPE system is that they have a variety of free screening tools there that can really be beneficial to helping you identify those students who do need support the most. Oh, I'm so sorry. I clicked on the link and it took me to the SHAPE system. Can you still see my slides? Yes, okay, great. So one other thing that you could do at your schools, if you are really at the beginning of this journey and you don't have the staff to be able to screen all of the students and provide that follow-up support, if you really need your classroom educators, the paraprofessionals, and the other folks in your school to just be educated on how to identify mental health crises and how to respond in a compassionate, trauma-informed way, way. The MHTTC network did create this 3-part training package called Classroom Wise that really delivers some mental health literacy information to classroom educators and others who work with students in the school building. And alongside that training package, there's also a website, classroomwise.org, where they have a resource collection. So you can take the course all the way through, or you can go to classroomwise.org and get some resources that you can pull from the website and take right into your school community. So that is all for our presentation. We'd love to open it up. So I'm going to pass it over to Martha to lead our Q&A session.
It looks like I'm having some trouble with my video, so I apologize for that. I'll turn it off if it keeps flickering. So we would love to open it up for questions, comments, issues that you're struggling with related to SEL programming. Feel free to unmute yourself. Yeah, Matthew.
The Classroom Wise, do staff get PD hours for participating in that?
We don't, they don't offer CEUs because it's a national program and that's run by the states, but they do have a certificate that they can get, I believe.
Okay.
If they just need credit with their administrators for hours. Our
Yeah.
course does offer CEUs.
Okay, good to know.
12 CEUs. So. Other questions or comments? It looks like many of you are new to our work. So I don't know, I put the link to our website in the chat so you could see the other types of trainings and supports and resources that we have available. Everything is, of course, free of charge. But we do, if you're looking for something really specific, like a webinar on the neurobiology of trauma, you know, we have that available through our video library. So if you're looking for resources on specific SEL topics that you think would be helpful for your staff, I encourage you to go there and also look in the broader MHTTC network nationally, because there's a lot of really great work going on there. Other questions or comments? Things you're wrestling with at the moment that might benefit from the eyes of your colleagues, the ears of your colleagues?
So we're the school that I'm at is kind of unique in that we're a charter school that we're the only district associated charter school in the state. So granted, that's relative for Rhode Island, but the challenge that I've seen kind of coming in October and being an outside from the outside looking in, we've got this rift, I think, and we're K to 12 as well, where you've got the staff are Providence public school employees, and then you've got administrators and support staff like myself that are Times Square employees. So now you know I'm looking to try to integrate different SEL programs and things like that, and trying to juggle the union and you know what teachers should and shouldn't do, can and can't do, and that's really where I'm having a hard time juggling some of those roadblocks. So I think finding something that is gonna, and that was kind of where my question about them getting credit hours, because if we were any other charter school that's taking kids in from everywhere, we've got our own staff and we can implement that as a requirement under their contracts, their agreements. Because I don't have any control over any of that, I'm kind of at the mercy of what the district PDs are dictating that they need. And basically the district doesn't care what our needs are, they just care what the district needs are. And they don't always align. So I guess my question in all of that is, how do I work within that to do to build a program that basically doesn't exist. I'm almost starting from scratch with staff that aren't buying in. I shouldn't say that. Some staff are restricted from buying in because of limitations around that are being put on them by the unions or by coworkers. And then there's pushback from the ones that just don't want anything to do with it. So I guess how to integrate something like this and working within that system.
That's a pretty important central question, isn't it? And I think it's one that a lot of people are struggling with, this sort of confluence of these big systems coming together and crashing into each other, right? And who's in the middle of that crash? It's people who are trying to do this work and our kids, right? And that's really, really tough. I think Dana and I have some ideas about resources, but I'd love to kick it to your colleagues to ask them, are any of you struggling with the same kind of issue? Do you have strategies, commiseration, feedback? What's working, what's not working?
I was gonna say, like, I know I'm not in your neck of the woods, but I mean, even here in ours, there's 5 middle schools and 11 elementary schools and 3 high schools. And we know that there are resources out, but it always sucks when a parent is calling in about needing something. And I'm like, I have to reach out to the school social workers, but the social workers are tied up because they're running 3 or 4 schools and finding the right thing. So I know that there are resources out there, but finding a way to combine them all, or, you know, put them in one central location so that it can get out to the parents is often, you know, the difficult part. Like I said, I've been in this position for 12 years and I know some of my families that struggle. But then I was a little shocked with all the new ones who needed a little extra help coming back in this year that I wasn't prepared for. So I think we're just struggling. Like, we know that there's good stuff out there. But it was almost like triaging and trying to figure out where to even begin. Do you start with the SEL stuff? Do you start with setting the parents up? Like, where do you even begin? So I don't know if I answered, but it was just kind of like, I feel your pain even down here in Virginia.
Yeah.
Like, you know, there's good stuff out there. It's just a matter of finding the time and the getting it to the right people. Mm-hmm.
Right. Getting that buy-in. Yeah, no, I think that was summarized it nicely, because at the end of the day, there's this it feels like two ends working against the middle. You've got everyone is in agreement that we're in it for the kids and how to best help them and support the families, and then there's that same divide of what's most important, academics or mental health. And trying to get, and I've been semi-successful with a decent number of staff of they can both be important, and you can balance both at the same time. It's not necessarily the easiest way to manage it, but if you want a kid to successfully finish their math test and do well on it, then you've got to take into account this kid's coming in with other things going on personally in their lives, or they're just tired today, they're just having an off day, and giving them a day to recuperate, study one more time, and then come in and take it the following day. And I think that's where I've been able to get some of that buy-in. But then there's the other end of the spectrum, and I said it kind of when I introduced myself, that you've got staff that think, when we talk about trauma-informed care, it's, oh, they're just making up excuses. They're it's not really they're just trying to get out of this and get out of that, and it's trying to and this is where I've been able to connect some with the understanding of, I'm not the kids in crisis and they come and see me. It's not a get out of jail free card. It's a, okay, here's what's going on. Okay, how can we help you? Okay, you still have the expectation to get XYZ done for next week. Would it be reasonable to extend the timeline a little bit? And you're still accountable for it, so to make sure it gets done, but we're going to provide support to get you there to get it done. And that's sorry, go ahead.
It looked like Trina had something that she wanted to interject, and it also looked like Meredith looked like she might have some feedback on that. So Trina, and then Meredith, if that's what you were.
I was going to say, I think it's all about communication. So, we had, obviously, like most schools, we had a lot of teacher turnover. So while my veteran teachers were used to knowing, like, listen, I have some parents that will call and be like, listen, Johnny didn't take his medication today. And I would send out a mass email to the teachers like, hey, he's off his kilter today, so you need to send him down. And, I just had one kid come in and he took a 20-minute nap in my office. And then he's gone back to class and the teacher was like, thank you. And just I make it a point to go by and talk to some of them later, like, hey, if it was out of line or if I need to pull them later and help. But I think communication with the teachers will help some of that buy-in too, and just being straight up honest, be like, I'm here to help. If it would help that one child get your class down to 25 for, a few minutes, but it's not a get out of jail free card. Or if I can take them and they can do the quiz in my office, and trust me, I'm not going to help them in math. But I think remembering that kids are first, and the last thing we want to do is put one more thing on our teachers. So finding that balance between this will be helpful, I just need to take a little more of your time, but finding out whether or not they can get PD points or whatever, and really presenting in that way should help, but we'll see.
Yeah. And I found that where I've kind of, it's that give and take, right? That right after the break, I shared with staff that if anybody need, like any of the teachers need just like a break from their class, from a difficult class, anything like that, that basically they have like a break card that I gave them that they can bring it to me, and I'll cover that period class for that day. So that way they get a respite from a challenging class. So trying to build that, again, that give and take, like I'm going to ask you for things along the way, but I'm not just going to hang you out to dry if you're having a hard time too.
Thank you. Meredith, did you want to add something, or was I mistaken? I do want to take a couple minutes to, it looks like Mary Kate has something. All the mental health supports in my district were tasked with reading a book that's kind of in a podcast form with Dr. Perry and Oprah. It's about trauma and connectedness, with some great stories and testimonials that she used. Using stories, quotes, the voices of your kids and families is powerful. Data is really important. It's essential for people distributing money, but really landing in people's hearts about how kids are suffering and also how they are resilient is incredibly powerful to changing minds and advocating for people. I think when leaders see the change that social emotional programming or social emotional support can make in a kid, that's pretty compelling. I mean, that's the best evidence that we have, right? That staff care more about than just academics. We just have a couple minutes left. I do want to share with you some of the other resources that we have. Classroom Wise is a great resource, the 3-hour-long course for mental health literacy for all staff, just to help staff begin to understand that this doesn't have to be overwhelming. Teachers don't have to be therapists. That there are small things that we can all do to create a culture where we support kids' mental health and well-being. So this is one of a series. Mary Kate says the book is What Happened to You? Conversations on Trauma, Resilience, and Healing. Thank you, Mary Kate. That's really helpful. This is one of a series. So our next session will be on February 10th about trauma responsive comprehensive school mental health. And then in March, we're going to be talking more about the nuts and bolts of using this course to train school staff on trauma responsive practices. And then we will be having more discussion. If you're, again, wrestling with something or asking for specific resources, you are each other's best resource, great people who are doing this work as well. So we hope that you will come back for sessions and check out some of our other offerings. The Heart Collective, I think, might be helpful for some of you. It's healthcare workers and educators addressing and reducing trauma, which is really about the intersection of those systems when they come together. The maybe healthcare workers or community health providers or community organizations and schools, and how to build collaborations that are, you know, get the job done, that are compassionate and, you know, really respond to the needs in the community. So please join us for our community of practice there or our webinar sessions. We're going to be doing the community of practice on the 20th, and then talking about the impact of implicit bias on BIPOC populations. And again, check out our webpage for more information on that. Next slide. Everything that we do is SAMHSA. We're funded by SAMHSA, and we're grateful to them for our funding. They do ask us to ask our audiences to answer a very quick evaluation in the form of 3 questions. Very easy. So it'd be a great favor to us if you would scan the QR code with your phone or go to the link that Ingrid just dropped in the chat to just fill that out. That helps us understand more about what our educators, school mental health providers, all of you working with our kids need and want. Contact us through this website or our email address if you have questions, ideas, resources. If you need anything specific, we can probably help you. Next slide. And there are Dana's and my email addresses if you have specific questions for us or want to reach out. We can also connect you to our larger Childhood Trauma Learning Collaborative base camp site with a lot of resources and support. And I think that that is it, except that we do have some slides in the slide deck that will walk you through how to sign up for the course, where to go, how to sign up, what it's like, and that will also give you access to the Classroom Wise course as well. So you can take a look at that if you have questions. Does anybody have any last comments or questions? We are so grateful that you took time out of what I know are really busy days to join us this morning. And we hope that you will come back to our next session, reach out with questions, explore our webpage, and consider using the course in your own and your team's professional development. So thank you so much, everybody. May you be healthy and well, and good luck in your work. We hope to see you again. Thank you so much.